talking a bit about endometriosis and about integrative models. I am an acupuncturist, Chinese medicine practitioner, but I'm also really into integrative medicine models. So I've been working in the fertility, reproductive care space, doing acupuncture and Chinese medicine things for about 18 years. But over that time, I also have been involved in some research around integrative medicine practices. And so I'm really interested in how we can better integrate complementary medicine alongside with medical care, and how patients can get more kind of comprehensive care where it's not just medical model or not just complementary, but how can we kind of coordinate it better. So that's the thesis of my talk. And yeah, I've been involved in some clinical trials around endometriosis, for acupuncture for endometriosis, and Nora's going to be talking more about that, and she's doing her PhD in acupuncture for endometriosis. And I've also been involved in other clinical trials to do with IVF and PCOS. So I think that's about it. I'm a big advocate for integrative medicine. And the Acupuncture Pregnancy Clinic is a Chinese medicine clinic that just really focuses on reproductive health, IVF care, and pregnancy support. And we've been around since 2008. We've been around a while. And we're kind of a research-based clinic. We first opened our doors in response to some research around IVF acupuncture being really beneficial for patients. And since then we've got locations in Sydney, in Westmead and Alexandria, CBD, Central Coast, East Melbourne and Mornington. So today I'm going to talk a bit about medical anthropology, a little bit about biomedicine, a little bit about integrative care, and just also like a framework which is often discussed in integrative models of things like communication, coordination and treatment plans. So some of this has already been touched on, that the prevalence of endometriosis is about 10%, according to the World Health Organization. It has about the same level as prevalence as diabetes. It doesn't get as much exposure, although that's starting to really change the conversation. And I have to say, from when I graduated in 2007, and I was very interested in endometriosis and women's health, the difference that has happened in the last 18 years is enormous in terms of how much press and how much people are paying attention to people with endometriosis. And it was a big reason why I went into women's reproductive care, because I felt like there wasn't enough options for people with PCOS, endometriosis and other reproductive conditions. So the average delay is delayed to diagnosis up to sort of 12 years. We've already spoken about that. Sorry, I'm just getting my notes. And a recent study by NICM, which is where Nora is at, the NICM Research Institute, they looked at the burden, the economic burden on Australia, and it was about $9.7 billion per year in Australia, the economic burden. And this wasn't through just treatment, although that was a part of it, but that was through lost productivity for people who have endometriosis. So even people who don't have endometriosis, it's a really important condition for us to be really looking at and trying to address. From a medical anthropology perspective, that look at it often culturally, menstruation and diseases of menstruation, although it surpasses just that framework, to be really kind of culturally minimised. So, biomedicine, which is, Western medicine, has some amazing strengths when it comes to endometriosis. Surgery can be amazing for deep infiltrating endometriosis. The different hormonal options can be huge game changers for people. Pain medication, a lot of people find difficult to live without. And also IVF can be hugely impactful for people who are having fertility struggles. But there is research to suggest that about half the people who undergo surgery have persistent pain after completing surgery for endometriosis. And there's also chronic inflammation, which has been discussed earlier, systemic symptoms. There's a lot of
also psychological burden, and people often do look for other types of supportive care. So today I want to talk a little bit about some of the integrative medicine. This is by no means comprehensive, but I'd like to talk about acupuncture, nutrition, Chinese medicine, and just different kind of holistic frameworks of looking at endometriosis. So the research around acupuncture and endometriosis, and I think Nora will be covering this a bit more as well, but it shows that there is an impact, acupuncture impacts pain and can reduce pain. Cytokine modulation, which is the immune kind of factors, and also autonomic regulation, which is really helpful. And it can be helpful for IVF support. And so, I mean, one of the mechanisms I think is quite interesting is the cytokine regulation. And this can improve pelvic circulation, and it also can improve pelvic circulation and calm the nervous system. In endometriosis, cytokines can be persistently really elevated, and this can keep the pelvic tissues in a constant state of kind of immune activation. And this sort of prolonged inflammatory signalling sensitizes the nerve endings and the surrounding structures, and often is what is driving that deep cyclic pelvic pain that so many people experience. So it also can disrupt hormonal communication and alter the uterine environment. So acupuncture's impact can be really helpful for these things. Another influence it can have is around like the hypothalamic pituitary axis, and this can be really helpful to help reduce stress. And in the IVF setting, there's been mixed research around acupuncture's evidence, but it has found that when acupuncture is used more than one session, more than just around embryo transfer, it can be helpful in terms of improving pregnancy rates for IVF patients. And there's also some good research around nutrition, particularly how omega-3s can help reduce inflammation, and how trans fats can increase. So nutrition can play a really major role in terms of the inflammatory picture of endometriosis. So one was like a nurse study that we're looking at, and it showed that women with higher trans fats intake had a 48% higher risk. And we also know that women with 60% of women with endometriosis also have IBS symptoms. So nutrition and dietary changes can be something that can be really helpful for these women in terms of improving some of their symptoms. And I think Amanda's going to be talking a bit more about this a little bit later. And so from a Chinese medicine point of view, it is a different epistemology, which means there's different patterns from a Chinese medicine point of view that we look at when we're looking at endometriosis. So we can have 5 people in the room who have endometriosis, and we will kind of diagnose them with different patterns and different presentations, and we'll treat them differently. And this kind of makes it more of an individualised care, or maybe a little bit different, just the way we do the pattern differentiation. And these are things like cheek stagnation or blood stagnation and heat. And there's a lot of overlap with this terminology, and also with inflammation and stress in the microcirculation. There's quite good randomised controlled trial evidence around menstrual pain, acupuncture helping with menstrual pain, also sleep, stress, and pelvic flow, which are all kind of factors which people experience who have endometriosis often experience. And then more from a bit more of an anthropological lens there, it's not trying to just understand the biology, but also looking at like the cultural factors around endometriosis. And across cultures, menstrual pain has often been dismissed or minimised. Emily Martin, who is a really interesting medical anthropologist, talks about the cultural silence of menstruation. And this contributes to diagnostic delays and conversations about it, and people learning about their symptoms. Also talks about how, biomedicine often will view diseases a bit more structurally, look at like lesions and biological things like hormones and adhesions, where traditional integrative medicine might look a bit more like at how the whole body behaves, and encompassing more symptoms, things like stress and sleep, digestion, pain patterns, and of course emotional well-being. So it's not that either view is kind of right or wrong, but it's just describing something from different angles that I think is different parts, sort of slices of the pie that make up the whole thing. And this is just a bit of a diagram just showing how endometriosis sits at the intersection of inflammation, nervous system activation, immune changes and hormonal influence, and how environmental factors can kind of impact it. And there's sort of no necessarily one single treatment that can really address all of these layers, which is why like a combined approach can make a lot of sense. And then I just want to talk a little bit about the kind of gold standards of endometriosis care, integrative care. And so the first one is really around kind of communication. So that's communication with the patient, communication between the different patients' care providers. And this can really help the patient from feeling like they're stuck in the middle and they're navigating their own care. And they're not having to go from one healthcare provider to the other, relaying what one's doing to the other. So good practices include things like letter writing or emails, but the different practitioners talking to each other. It helps the patient feel more supported, reduces their overwhelm, and also helps them sort of build trust with their plan. And coordination, so multidisciplinary care is recommended in the 2021 Australian Endometriosis Guidelines, and this is to help try and avoid mixed advice or duplication of different care. It helps reduce the patient's also burnout when they're trying to manage all of these. Like we've had patients coming with files, I kid you not, this big, with all their test results. And this can be helpful also when we're doing IVF and coordinating that extra layer of treatment that they're undergoing, which can, in endometriosis, sometimes really flare things up. And yeah, having a comprehensive plan also means that we're just not relying on like one treatment, to do everything. It means that we're looking at things more holistically, and supporting people through all the different stages and where they're at, whether it be a flare-up or the medical treatment that they're undergoing, or surgery they're undergoing, IVF cycles, and where they're at in their daily kind of life. Yeah, so a complete plan might look like things like talking about things like surgery or hormonal treatment, pain management, acupuncture, nutrition, psychological support, sleep and stress strategies, lifestyle guidance, and coordinating these with the fertility specialist or other specialists. And this is an approach that mirrors what's often used in other kind of complex and chronic conditions. And I think looking at it from this lens as a chronic and complex condition is really helpful, and can help people kind of tailor their care towards their specific symptoms and goals. And I think this is particularly relevant for people undergoing IVF, because these other things might help them stabilise their symptoms before undergoing stimulation and help reduce inflammation. And just general things that make you feel well, like sleep, digestion, and all these sort of things. So there's just a couple of studies or cases just looking at like integrative models that are helpful. So this one was looking at how, and it was Dr. Armour at NICM, who looked at how women with endometriosis used acupuncture and lifestyle support across several clinics. And it had a look at, explored how the endometriosis experience with acupuncture was used with their symptoms. So it was a qualitative study, and rather than measuring just like pain scores or physiological markers, it looked at the women's description of how acupuncture had felt, how they responded to it, and the aspects they felt had helped or had not helped. And the goal was just to really better understand how women's lived experience of endometriosis, how it was, and how their symptoms might be better managed. But overall, women who were in the study, they overall reported just better energy levels, reduced pain days, increased kind of emotional resilience, and also increased treatment adherence. The second one was a study looking at dietary counselling combined with standard medical care and how it influenced symptoms. So they found that people who experienced fewer digestive symptoms, less bloating, better energy with dietary counselling and changes. Better energy, and also it reported a better improved quality of life. But basically, I think integrative models can be really helpful for a lot of people undergoing, who have endometriosis, and also people who are undergoing IVF. It can really be helpful for people to feel more supported, more calm, and have better pain management options, as well as improved stimulation experience, because sometimes IVF stimulation can, it can have some side effects, and also be able to get a better adherence to IVF or fertility treatment, because it's these things are managed. Okay, I think that's all from me, so thank you very much for your time.